think it's preparation. The speed at which it happens and how quickly it overwhelms your health system and then begins to affect all of society. I mean, that speed is if you haven't experienced it before, it's difficult to describe it or difficult to imagine how fast it is. And so I think for us across Africa, but other parts of the world, I think China bought us a significant amount of time. And in a month or so, in the 6 weeks or 8 weeks it took before it started spreading to other parts of the world, I wish people had used that time to prepare. And we tried. For those of us who experienced this in West Africa, we tried to warn and caution our counterparts that preparation is really, really important. In fact, at the end of the Ebola crisis, I did an event here in DC. I was still in government then, and I was asked, what would you, what would be the defining, message? And I said just over preparation. If the projections are you're going to need 1,000 beds, you should have 2,000, because the way to beat this is to be ahead of it. If you're preparing while it's happening, you're behind already. In a lot of places, the social contract between the state and the people is frayed. The social contract between the state and the people has not been serviced properly. And so because of that, social cohesion is not the strongest. We had come out of a war in Liberia, and we're a post-conflict society, and we're still trying to build that trust between government and people. The government also decided that it was going to be as open as possible and as free as possible. And so because of that, people were free to criticize the government, and there were lots of reports of corruption. And so because of that, it helped to undermine the trust between the government and the people. And so to be able to get compliance from a people who no longer trust the government was quick to resort to the use of force. And we tried to physically quarantine geographic areas, and people, because it was an informal economy, it still is, people bristled because it meant confining those people to starvation. And so there was a lot of pushback, and the army was brought in to enforce the quarantine, and a young man was killed, multiple people were injured. And we're seeing the same thing, the same lessons being learned across the continent, where lockdowns and movement restrictions are being enforced by the use of force, because again, there's very little social capital for the government to be able to dispense in this situation. And since you're not going to manufacture social capital in the midst of a crisis, most governments have resorted to the use of force. It became clear that for us, the evolution of our strategy was that this disease was going to be with us for a long time. And over the course of the disease, we were not going to find a medical countermeasure. And so behavior change in the people would be important. And so a community-focused approach made the most sense for us, and we evolved to that. So in a community-focused approach, we brought in other actors so that the state alone wasn't in charge of the response. So it became a problem because you have small church groups in America. You had diaspora groups. You had multiple non-governmental organizations, NGOs, who requested and received approval from their donors to repurpose their money for Ebola response. And consequently, you had a government that, even in the best of times, wasn't staffed adequately at every position. And so all of a sudden, you had this significant strain on the state's ability to absorb and efficiently use the amount of help it was getting. One of the ways we did that was to just reorganize the response. So we had an incident management system that was managing the emergency. And that incident management system was then broken into the health-related portion of it, the procurement-related portion of it. And so once the people who are responding to the health crisis were relieved of having to receive donations, package donations, manage logistics, they were able to focus on that. And so having an organized incident management team in place helped us to be able to do that. And over the course of the response, we also began to encourage people to channel their support to certain organizations, and those organizations were able to onward move it to the country, and it allowed us to be able to get over the chaos of having to respond to multiple sources of donations and assistance. So first of all, the ministers are the president's closest advisors, and all of the big decisions that are going to be made in country, the ministers, most of those decisions are made at the cabinet level. Sometimes it will be the EMT, the economic management team, but again, cabinet is the highest decision-making body in the executive. And one of the things that becomes evident is that because these are not normal times, we're going to have to suspend some of the projects. So certain roads are not going to be built. Those roads might be 2 years late, and resources that would have gone into road construction will now be repurposed for the response. And so first, just outside the Ministry of Finance and the Minister of Health, other ministers looking at their budgets and seeing things that because of the crisis, they're not going to be able to do, and be able to make recommendations to their colleagues that, listen, you can take this out of our budget, you can take this out of our budget. It's really, really helpful instead of forcing the Minister of Finance to be able to call from budgets, right? So if ministers are proactive in terms of looking at their budgets and making recommendations, I think that's very, very useful. The second thing is the Minister of Health. Obviously, everybody in politics has heard this saying that you can't let a good crisis go to waste. So the Minister of Health might be tempted to use the crisis to finance things that he's been asking the Minister of Finance for a long time. And now that he has this crisis, he wants to be able to take advantage of that. As much I would recommend to the Ministers of Finance to exercise as much restraint as possible to be able to do that. Because first, we don't know the duration of this crisis. With Ebola, we wait 21 days. And if there are because it takes 21 days on the incubation period of the virus, and then people become symptomatic. And then after a while, we decided to extend it to 42 days. So, but with this, because it's happening everywhere in the world, there are always going to be flare-ups here and there. And so because of the length of time this response might take, it's really, really important that budgeting from the Ministry of Health and other ministries, that budgeting is focused on the long term. You need a policy intervention that is sustainable over the long haul. And hopefully agencies and ministries that are directly responding to the crisis will not use it as an opportunity to finance pet projects that they have been trying to get money from the Minister of Finance for a while. The second thing also is some of the ministries and agencies who are not directly involved, the Minister of Finance also needs to, when you reach out to people in terms of calling their budgets, to be able to do it in such a way that people feel that they're a part of a process and they're not unimportant. Because in the midst of a crisis like this one, the last thing you want is the infighting and intra-cabinet fighting that occurs in normal times. But if the Minister of Finance takes on the airs of being, Lord, people tend to forget about the crisis that is at hand and then begin to fight. And so I think Ministers of Finance and Health are going to be leading in terms of the response, but that's just in terms of budgeting and then in terms of making the resources available, because now the entire economy has to be repurposed to save lives so that the economy has an opportunity to be able to be revived. I think when the crisis first happens, civil society organizations, international partners, and private citizens are going to be calling on the government to do something, and the government itself wanting to be seen as doing something is going to do something. what I would advise is along the way, there needs to be time for the government to sit down and come up with a plan. Otherwise, you're going to waste a lot of resources with haphazard plan of doing something in places that require doing something. And in a situation where resources are limited, having a central plan, a plan that is adjusted and adapted and reassessed and reviewed going forward, but having a central plan is really, really important. I know it seems like it doesn't make sense that we're responding to a crisis. You're talking about planning, but planning is probably the most important thing, and one cannot overemphasize that.